I'm Dr. Elizabeth McCrillis, Director of the Trent Centre for Aging and Society. Soon after the onset of COVID-19, Trent University's Office for Research and Innovation announced a special call for research related to the pandemic. In April of 2020, we at the Centre for Aging were so pleased to announce that 7 of our members were involved in the funded research. As COVID-19 so significantly impacts older people, it's not surprising that almost half of the funded research had an aging studies component. The projects include how culture and gender matter in creating age-friendly cities, volunteerism in rural communities, and addressing social isolation. In this TCAS video series, we are going to profile 3 of those projects that are focusing on aging. This video features the Social Isolation to Social Connection project.
The World Health Organization saw that there was a demographic shift in the seniors population, and they encouraged communities to be more age-friendly. So when Peterborough knew that, they did a consultation with the community, and we spoke to over 1,000 individuals, whether they were from organizations or from the senior service sector or seniors themselves. And from that, we developed 4 goals. One is basic needs. The second one is staying mobile. The third is building relationships. And the 4th is learning and contributing. And those are based on the World Health Organization 8 domains. And so from that, we developed a community action plan that outlines tasks for each of the working groups. So the working groups had a meeting and determined their priorities from those actions. And each group has task forces that work on those initiatives as well. So the basic needs working group was working on a health and housing navigation study. And what they did was determine a list, so created a service directory of healthy aging or organizations or services that support healthy aging. And the other directory is in housing. So a senior, it could range from a shelter to a 5-star retirement residence. And we have a list, a complete list of options for seniors. So if they want to stay at home and they would like to have services, whether in the home or be able to go to services, we have a list, we have a directory. And that was really important for us. There were many different lists, and now we have one central one. And from that, we have developed a social isolation to social inclusion project. And that it ties into the health and housing navigation study, because we know that seniors who are isolated, their health declines, and we want to be preventative. So if we encourage healthy aging and services that support that, as well as options that promote social inclusion in housing as well, we feel that we will help the Peterborough, the seniors who live in the greater Peterborough area. So that's where the social isolation project concept came from.
What triggered this research project was really the COVID pandemic, in that when the pandemic struck, people were forced to self-isolate and were socially isolating in addition to maybe the way they were living before. So in particular, seniors are at risk, and Public Health Agency of Canada has defined those over 70. But people who may have had trouble doing their own activities of daily living, like getting groceries, or maybe they may have been more anxious and worried because of the pandemic, and with fewer supports because of social isolation, that puts them further at risk. So our thoughts went to those people who were struggling through COVID, and we were meeting as a group with a number of community organizations and seniors and other members of Age Friendly Peterborough, And we wanted to do something to support seniors in our community who were living with even further imposed social isolation in our Peterborough County and the rural areas surrounding it, which are particularly vulnerable, as well as paying special attention to indigenous communities as well. Well, the overall aim of the research project is to mitigate those negative social and health impacts as a result of further social isolation related to COVID-19 pandemic. And we're in particularly wanting to uncover experiences and stories of seniors and their caregivers, both familial and formal caregivers, so that they can help us really understand what services, programs, and policies have affected that social isolation, and think about ways that they have helped them cope or barriers to them coping during the pandemic. And then that helps us prepare for life after the pandemic by addressing their suggestions for changes in services, policies, and programs. Age Friendly Peterborough is a network of businesses, seniors, community organizations, municipal staff, senior citizens, people of many generations. And it's a network that is really trying to address the betterment of seniors in our region. So that group was existing already. And in addition to that, Public Health established weekly teleconferences as community organizations and networks to support seniors in our community during the pandemic. So they are the crux and backbone of how the research developed. We have a core team of researchers, myself, Ann MacLeod, and I'm a nursing faculty with Trent-Fleming School of Nursing. Dr. Catherine Ward-Griffin, who's a professor emeritus from University of Western Ontario and a senior in our rural area. And we have Jayne Culbert, who's the Age Friendly Peterborough coordinator, and Berry-Merriam, who's a senior as well as a long-time planner in our community and has done a lot of consulting in our region. And we're fortunate as well to have a grad student, Justine Levesque, on our project. And more recently, we have 4 other undergraduate students working as well. So in addition to that, we have key informants, and those are our key partners who really know seniors in our community, whether they're managers or frontline workers from different organizations or have extensive networks into the rural areas of our communities or indigenous communities. In addition to those people, we have just community at large that are all part of the project.
Oh, this is really an exciting opportunity. We have a really fabulous research team that includes not only researchers but our collaborators and a number of undergraduate and graduate students. And given that's who we're going to be working with, using a participatory action research approach just seemed natural. It's the one that really seemed to fit. And what that means is that everyone, including of course the participants that we will be speaking with, that they will have a voice about what it's like to experience COVID-19 during and potentially after, and how it's impacted their social connections. So the participatory piece is really key, and it's not just involvement. It is really to make sure that people are involved in the research design right from the development of research questions right to the knowledge translation and everything in between. And so that's terrific that we're able to do that. I have been involved in a couple of PAR projects before, and they're challenging, but they're very rewarding, and I think everyone learns from them. So in terms of the methods that we use, we are conducting interviews. We're conducting interviews with seniors and their family caregivers, which could be family or friends or neighbors, whoever they say family is, as well as any formal caregivers that they may come in contact. It could be a personal support worker, it could be a volunteer. So we're going to ask them to participate and tell us their experience of what it's like. And we're using a semi-structured interview guide, and we're actually conducting them not face-to-face because of COVID, but over the telephone or using Zoom. The other data collection technique we're using is retrieving documents, a number of documents that we've already looked at actually, at the global level, the national, provincial, and on down to even organizational policies that certainly affect practices or policies or programs that are already currently being offered. So with the whole intent of trying to understand how we can identify and prevent or even mitigate, the effects of social isolation. And we got those three really rich, in-depth information from those three perspectives of seniors, informal caregivers, and formal caregivers. So once we do that, we'll be analyzing the data, and part of the analysis is to develop themes. We're going to be doing some thematic analysis, and that will be jointly with a number of the research team. But once we have a really good handle, or we think we have a good handle on what emerged from the findings, we're going to offer focus groups. So there will be some refinement. So there's a good example of PAR, how we now bring the participants back and say, is this what does this resonate with your experience? Have we captured your experiences? So there will be some refinement, and we'll be taking that back and finalizing that. So that's really exciting. What we hope, of course, the end product is that we will have some really exciting deliverables, as we call them. They not only publications and presentations from the research findings of our qualitative research study, but also maybe to do something a little innovative. I know at the focus group we're hoping, if it is possible, that there may be some opportunity for the participants to show some artwork or something like that, something more visual. So we can get creative and innovative. We could maybe even take some of the findings and develop vignettes and invite service providers to respond. I've done that in the past, or even write a policy brief. So there's lots of things that we can roll out, and everyone will be involved as much as they would like, the organizations, and they will be definitely very instrumental in making this success, that the knowledge gets what we call translated or put out there and shared and exchanged with everybody. Like, what difference does it make? What I call is the so what question. And also, now what? Like, where do we go? And that's the PAR, that action piece. So it's too early to say because we haven't finished the study. But by and large, we're really hoping that we will identify policies that are maybe a little bit short-sighted or not as inclusive as possible, even though they're well-intentioned, or missing policies or missing services, or the types of services perhaps are not appropriate for maybe seniors in the rural area as opposed to in the city. So those are the kinds of nuances that we hope to identify, and then obviously work with our partners so they can make changes in what I call the 3 Ps, the policies, the practices, and the programs, to make a difference in the lives of seniors and their caregivers. One of the strengths of using a PAR approach is that the students can get so involved throughout the whole research design and get involved and get really hands-on approach. And so currently we have a number of graduate and undergraduate students in our that's on the research team, and they're learning all sorts of things. They're learning, how to conduct interviews, the challenges of doing a telephone interview, what to do with the interview and transcribing it and then coding it and analyzing and then running focus groups and helping with that. And then lastly, how what to do, how to write up these research findings, in terms of presentations or publications, and taking it back to groups such as Age Friendly Peterborough, and making sure that we are true to the principles of PAR. So I really think that the students are having a great opportunity of learning here.
So I have a couple different roles on the project in different areas. Primarily right now I'm working on the research study that's funded through the grant through Trent. And with that I'm really working on the data collection and analysis. I'm really looking forward to doing the interviews with our participants to give them kind of a voice about their experiences during the pandemic with social isolation. And then I'm also going to be working on the communication part, primarily helping to develop a communication plan for our community organizations to get out the information that we find with our research study and through the other pieces of the project to help seniors get more socially connected and find the resources that we're creating. And then I'm also in the health and housing section of the project as well. I'm working on identifying best practices for housing and creating recommendations to help address social isolation with seniors with different types of housing, and specifically with community-based research. And in Peterborough, the networks and the connections that have been created through Age Friendly Peterborough have been really instrumental in creating our research study and helping us to identify the research question and the issue of social isolation among seniors that we're addressing. And they're also going to be really helpful in our recruitment of our participants to reach the marginalized seniors and their caregivers who otherwise may not have a voice to express their experiences during the pandemic.
We'll be connecting it back to the community in a variety of different ways. Research really has to be used by others. We'll be sharing it with municipal council members and decision makers, our provincial decision makers, including our MPP, and our federal. Because some of the changes that are going to have to take place will include federal and provincial opportunities for programming, and also changes in attitude in them looking at how seniors need to be more connected. It's also going to need to be multi-generational, so that we get more people thinking that the issues of one generation are going to be impacted by another generation, and also should be a collaborative approach in terms of